During the first month after birth, the baby's state is constantly changing. The skin may redden, the pimples may appear on the body, or the eyes may seem to get crossed. Let's see what is normal for a newborn and what should raise concerns. There is such a thing like psychological weight loss. Firstly, during the first days after birth, the baby as a rule does not eat. Secondly, a few grams go out with meconium, the original feces. And then, when the child urinates, all these factors in total cause a loss up to 10% of the newborn's weight. This is absolutely normal. Some doctors even consider the 15% weight loss to be normal. That is, a child weighing 3,600 grams can lose weight by 360 grams. It is not necessary to overfeed the newborn so that he gains weight. We follow the standard scheme, eating every 3 hours. Next, the newborn will gain about 150 grams per week, and by the end of the first month of life, he will gain about 600 grams. Once a week, weigh the baby for control. On the first day after birth, the baby can sleep without waking up at all, especially after cesarean section. If the child sleeps for a long time on the second or third day, then this is a reason to worry. The newborn should be woken up approximately every 3 hours for feeding, both day and night. Otherwise, the baby will have a breakdown. He will not have the energy to wake up, scream, suck a pacifier. In general, do not expect an excessive activity from the newborn. In the first weeks of life, wakeful periods last a maximum of 15 to 20 minutes. This is newborn's strabismus, a condition which most often disappears after a few weeks or months. The infant's eyeball muscles are not yet properly formed. In the first month of life, the child does not even know how to focus, and his eyeballs run around. Just give your baby time to develop at his own pace. At about 3 months old, he will begin to focus on his parents' face, toys, and will smile. And if strabismus persists at this age, then this is an occasion to contact an ophthalmologist. In general, we recommend being examined by an ophthalmologist at 4 months, at 6 months, and a year. The doctor will check the structure of the eye, ocular fundus, especially the movement of the eyeballs. By the way, there is one curious fact about the eyesight. Hanging over a bed of mobiles, rattles, or toys makes sense only after 3 months. In this case, we recommend hanging them at a distance of 50 to 70 centimeters. Otherwise, it'll be uncomfortable for the child to focus on them. Some doctors recommend using not even toys, but black and white large pictures. It's easier for the baby to distinguish contrasting colors than to catch them with a look. It can be really cold for the child. Comfortable temperatures for adults and newborns are different. The baby's body still does not cope well with heat transfer. His sweat glands are not developed. Therefore, it's good for him when the room temperature is 22 to 24 degrees. If the baby feels warm, then his skin is pink without a bluish tint, warm or slightly cool to the touch. If a child is cold, then his hands and feet are usually cold. But a cold nose does not mean anything. In any case, it is the coldest part of our body. If the child is cold, put his warm socks on. No scratch mittens and a hat. But you should not swaddle a newborn. It's better if he can freely move his arms and legs and get warm in such a way. Also, do not wrap the newborn in a warm blanket or overheat him in other ways. It can cause sweating, sickness, or pimples on the skin. Moreover, twice a day, be sure to ventilate the room in which the child is. If you doubt whether the child is cold, just measure the temperature. If it's between 36.6 to 37.5, then it's all right. In general, parents should have a habit of measuring the temperature of a newborn twice a day. It may not always be an allergy. Firstly, newborns have a very high level of hemoglobin due to the fact that there are a lot of erythrocytes in the blood. If an adult has an indicator of about 120, then a newborn has 200 to 220, so the baby looks so ruddy. Secondly, the baby may have physiological erythema. Children have very sensitive skin, which was protected by original lubrication until recently. Now it has disappeared, and such external factors such as air, water, etc. began influence on the baby. Redness is a skin reaction to an unusual condition. It is one of the stages of adaptation to the world. Usually, physiological erythema disappears within a few days without any treatment. In addition, the pimple-like rashes may appear on the skin due to hormonal changes, but these are not acne in its purest form. These are red pimple-like rashes with a whitish apex and without contents. If there are a lot of pimples, they can be lubricated with an antiseptic solution. No other treatment is needed. But in general, the nature of redness should be closely monitored. The skin should not peel off or be covered with pimples. This is exactly what evidence of allergy. Most likely, this is physiological jaundice. Newborns have a lot of erythrocytes, and they are constantly being updated. When the aged ones break down, bilirubin is formed, which is excreted through the liver. Excess bilirubin colors the child in a yellowish tint. The doctor can take measurements using a special apparatus, which is called a transcutaneous bilirubin meter. If the indicators are too high, he prescribes the treatment. Usually it consists in the baby lying under a special phototherapy lamp. In other cases, physiological jaundice passes without any treatment up to about the 14th day. Regulation is a common thing for a baby. The infant's cardiac sphincter, the circular muscle located between the stomach and the esophagus, is weak. The stomach contents splash about when the diaphragm passes on it. This can happen during a short spasm of the diaphragm, when the baby is turned on his tummy or in general somehow change the position of the body. Parents should monitor the nature of regulation. If the formula milk simply flows out of the mouth after feeding, then that's okay. If the newborn spits up with a fountain, then this is an occasion to visit a doctor. Your child may need Antraflux infant formula. If it happens when the woman is breastfeeding, perhaps the woman's diet is not suitable for the baby. In any case, the doctor should examine such a child. If the baby has breast swelling, no matter if it's a boy or a girl, so it is one of the symptoms of a hormonal crisis. Often, it additionally manifests itself in the form of pimples on the body and edema of external genital organs. Sometimes girls' vaginal mucosa becomes inflamed and there are even a bloody discharge, like menstruation. The reason for this is hormones, estrogen, prolactin, and others. The concentration of the hormonal cocktail is off the scale of the woman's body before birth, and the child can take part of this dose. As a result, there are all manifestations that I talked about. You should inform the doctor about this, but as a rule, the treatment is not required. Moreover, you should not compress or lubricate the skin with ointments without doctor's recommendation. As usual, this condition will pass within 2 to 3 weeks. Newborns do not breathe like adults. They have narrow nasal passages, so breathing is shallow and frequent, up to 60 breaths per minute. A newborn can sniff and even grunt a little. Sometimes it can be confused with a runny nose. Sometimes the baby inhales several times but exhales only one time. And at night, he sometimes breathes often and then suddenly flinches. This is also normal. If there are no whistles, wheezing, or prolonged breath holdings, then everything is fine. This is a very controversial issue. Of course, scientists and pediatricians have compiled many tables with development standards. For example, the baby should keep his head at 2 months, roll over at 3, and sit down at 6 months. But in practice, all of these shoulds have little meaning. Each child develops at his own pace. A healthy child has a good night's sleep, appetite, and stool. After 3 months, he focuses on faces and smiles at his parents. The rest of the stages, the child can go at his own pace. I know a story where a pediatrician scared a young mother with the words, "How is it possible? The child is already 3 months old, but he still doesn't roll over?" A woman came home and turned the child around for 2 hours trying to teach him to roll over. Do not do this. If the child does not roll over, it's not a reason to sound the alarm. It's important that he should try to do it, also be active and not sluggish. Do not try to teach your child to sit ahead of time. It is no need to load the spine. He is not yet ready for it. At first, let the baby sit up on his own in a crib or a stroller. I can reassure moms, even with my own example. My absolutely healthy and now almost adult son began to roll over at 4 months and sit at 8. But his first tooth erupted at 3.5, although it should erupt after 6 months. Do not push the baby. Just spend more time with him. Hold him in your arms, talk to him, and you should not find fault with the baby trying to make him develop up to book standards.